Porcelain crowns are usually needed for patients with compromised tooth structure, large restorations, and old crowns requiring replacement. In this example, the patient has 4 incisors with large defective composite fillings. These are the final all-ceramic crowns. Porcelain veneers were also placed on the canine teeth to complete the smile design. We now have porcelains available that allow the dental technician to duplicate natural teeth. Also note the healthy surrounding gum tissue. This patient requires 4 porcelain crowns due to the lack of healthy tooth structure. All the remaining teeth will have in-office bleaching prior to choosing the final color of the crowns. This is the intraoral view of the anterior teeth prior to treatment. The large existing composite fillings are seen. Also notice the black area between the central incisors where the gum tissue has receded. These are the final 4 porcelain crowns. The open area near the gums have closed. The smile meets the optimal aesthetics of proper tooth display and incisal edges that follow the outline of the lower lip. This patient fractured her existing porcelain crown. The tooth had previous root canal therapy. Note the darkness at the gum tissue. The tooth on the left has a large composite filling that will be replaced with a partial porcelain bonded veneer. The porcelain crown is supported by an all-ceramic post. This allows a transmission of light as found in natural teeth. The partial porcelain veneer has a wavy edge that masks the junction between the porcelain and the tooth enamel. This is the final result. Note that the all-ceramic crown on the right has the color and internal characterizations that harmonize with the patient's natural teeth. The edge of the partial porcelain veneer on the left is not discernible. This patient has 6 old porcelain metal crowns that need replacement. Note the dark roots and the gray metal of the crowns. The final all porcelain crowns mimic the color, vitality, and brightness of her natural teeth. The darkness of the roots has been masked. Porcelain veneers are thin, durable ceramic facings that are directly bonded to the enamel of each tooth. Porcelain veneers can correct deficiencies of color, shape, length, and also close spaces. This young patient has narrow existing teeth. Her orthodontist moved the teeth into optimal positions so that the porcelain veneers can duplicate proper width and length. The final result is 6 upper porcelain veneers and 4 lower veneers that close the spaces between the teeth and reproduces the proper width and length. In the smile view, the porcelain veneers duplicate healthy natural teeth, which improves her smile. Porcelain veneers can also restore the original length for teeth that have been worn down. This is the new appearance after bonding two porcelain veneers to the central incisor teeth. A night guard is recommended during sleep to protect the veneers. Sometimes a porcelain veneer can be bonded to teeth without the removal of any enamel. The patient shown here has a deficiency in length and prominence of the central incisor on the left. This is the porcelain veneer that has been bonded onto the natural tooth enamel. The porcelain veneer establishes the proper length and prominence of the natural incisor tooth. The internal colors and translucencies are harmonious with the surrounding teeth. Porcelain veneers not only improve the color and shape of teeth, but also can eliminate the dark areas near the gum tissue, which are known as the black triangles. The shape of this patient's upper anterior teeth prevents the gum tissue from completely filling the spaces. Simply changing the contours of the porcelain veneers between the teeth allows the gum tissue to fill in and eliminate the black triangles. The patient's smile reveals the aesthetic importance of closing the gum spaces that were previously visible. Partial porcelain veneers offer a solution for the replacement of existing composite fillings. In this case, the central incisor filling is discolored and worn. The partial porcelain veneer only replaces the existing composite filling without removing additional tooth structure. The wavy margin hides the junction of the porcelain to the natural tooth. This is the result following enamel bonding of the partial porcelain veneer. Notice that the edge of the porcelain blends into the adjacent tooth structure. This patient requires the replacement of the crown on the left and the composite filling on the right. She was also troubled by the appearance of the dark triangle whenever she smiled. An aesthetic result is also complicated by the differences in width. The proper tooth dimensions must be addressed prior to the final crown and partial veneer. The final porcelain crown is shown on the left, and the partial porcelain veneer on the right. Again, the wavy edge helps disguise the junction between the porcelain and the natural tooth. The smile view shows that the gum tissue now has filled the gap between the central incisors. Also note that the width of these teeth are the same and the partial veneer's edge is not apparent.